I always tell the doctors that the reality is being great in the operating room when the patient's asleep and no one can see you doesn't make them have a good experience. The patient experience is one of the single most important things we deliver. And as surgeons, it's one of the worst things we deliver. We do a very poor job post-op managing pain and anxiety and patients' concerns. And I spent a lifetime trying to do that, giving every patient my cell phone for 20 years. We do a poor job preoperatively of making people feel loved and valued and safe. And part of it is the system. We're seeing 20, 30, 40 people in our clinic day. Part of it is the business of medicine. And, I was COO of the healthcare system for a while and have an MBA, and I understand all that, no money, no mission. But the reason I like medicine better and caring for patients than the business part is because this is what makes it all worth it. When you have a patient that you and your team are lucky enough to be able to deliver the outcome that they deserve.
Welcome to the Forward Think Tank podcast, a place of hope, inspiration, and education around holistic health and healing. I'm your host, Jamie Mazza, a holistic health coach, mental health advocate, and dancer. Join me as I share out-of-the-box conversations with integrative doctors, healers, and exceptional forward-thinking individuals thriving on the other side of their health challenges, as well as stories from my own personal healing journey. Thank you for tuning in. I'm so happy you're here. Hello, friends. In this week's episode on the Forward Think Tank, I have one of the most special guests of my life, somebody who very quickly became one of my favorite humans in this world, my thoracic surgeon, Dr. Robert J. Cerfolio. He is the chief of thoracic surgery at NYU Langone. And not only is he incredibly brilliant, talented, skilled, he's done over 19,000 thoracic surgeries in his career, but this man also has a heart of gold. And I have been thinking about this introduction for weeks now, ever since I knew I was going to have him on the podcast. How do you introduce the man who, and excuse me for fighting back tears, but how do you introduce the man who, quite honestly, changed the trajectory of the rest of my life and saved my health at a time where no other surgeon agreed to be on board for this surgery? And not only that, but this man had an R0 resection at the end of my long surgery, which means that he left nothing inside of my body that was visible to the naked eye. It is truly incredible. I mean, this man, you'll see why I love him so much. As he self-proclaims, he is full of verve. He has a wonderful personality. He is my people. He matched my energy. He is just a bright, bright light, and he is the confident, courageous surgeon, and truthfully, the friend and the biggest supporter that I needed to champion my longevity and my health on the other side of surgery. So, Dr. Cerfolio, if you are watching this playback, I love you so much. I know you know that. This man gave me his phone number. I reach out to him if I have questions. He is compassionate and a very unique individual. Out of all the surgeons that I met with and all the doctors that I've come into contact with over the last year, he is one of a kind. And to give you a little bit more about his professional biography, here we go. As Chief of Clinical Thoracic Surgery at NYU Langone in New York City, Dr. Robert Cerfolio treats patients who have lung cancer, esophageal cancer, and cancers in the thoracic area, and provides surgical treatment to manage abnormalities of the chest outside of the heart. Inspired to pursue medicine by his father, a urologist, Dr. Cerfolio has now performed more than 19,000 thoracic surgeries in his career. His robotic surgical techniques, which have improved survival rates and reduced complications, have been adopted by experts across the country and around the world. Dr. Cerfolio's practice centers around the patient experience and finding innovative ways to care for people and improve treatment outcomes and recovery times. Working with a wide variety of experts, including nutritionists, chemotherapy specialists, radiation oncologists, surgical oncologists, and psychosocial and spiritual care teams, Dr. Cerfolio strives to treat each patient as a whole person rather than as a body part or a condition. Dr. Cerfolio offers online visits for both preoperative and postoperative appointments. During a video visit, he reviews all of your laboratory tests with you, visually examines you, and discusses your diagnosis and treatment. By providing online visits, Dr. Cerfolio is able to consult with patients across the country and around the world. In addition to patient care, Dr. Cerfolio also performs research to improve clinical clinical outcomes and patient experiences. He has published more than 150 peer-reviewed articles and 40 book chapters, and previously served as president of the Southern Thoracic Surgical Association. His first book, Performing at Work and at Home, The Athleticism of Surgery and Life, was published in 2014. I mean, how do I put into words how much he has meant to me? As you'll see, we have quite a good rapport. His personality very much matched mine. I knew as soon as I met him, my whole body took a sigh of relief, because I felt like not only was I in good hands, but I was in the hands of somebody who saw me as a whole person. He looked at me as a human being. He made my husband feel comfortable. He gave us a hug. This man told me he had been praying for me, which meant the world to me. He really put me back in the driver's seat of my health. And he said yes to a surgery that he knew was complicated, that he knew that other surgeons that had said no to, and said, I can do this. I have the utmost confidence in my team, and I hear you, and you are too young for this. You deserve to have a quality of life on the other side. I was fighting back tears, truthfully, in our interview, because this man, not only does he do this for a living, and he is so humble about it, as you'll see, he doesn't take the credit for it. He credits his team. He credits me for doing the work, which I appreciate, because of course, there's been a lot of hard work that I've put in every day. So to have that acknowledged by a professional surgeon is just the cherry on top. His bedside manner is 199%. His dedication to his craft and his excellence at being not just the best surgeon, but the best father, the best husband. And you'll hear him share his story as I was fighting back tears. And I'm sure part of this unique experience that I received from him is due in part because he has a personal experience sitting in my husband's chair. Unfortunately, he lost his wife to breast cancer from complications of chemotherapy, as he briefly shares in this episode. And I have no doubt that that gave him a completely different lens of looking at the patient experience. And so it breaks my heart to know that, because this man, to me, deserves the world. And I'm sure that has changed the way that he works with his patients. And excuse me, because I'm sitting here getting teary-eyed again. He is just such a special human being, and he brought so much comfort and so much peace to my heart at a time that really felt, unimaginable and hard to pull myself out of. I'm sitting here thinking, should I stop and pull myself together? But no, I think I'm a forward person. There are a lot of emotions that come up in a patient's life when you go through something this serious. So to have somebody who not only made me feel good about myself, instilled my confidence, told me to get strong, encouraged me to work out, pushed me to really take care of myself before the surgery, and then followed up with me thoroughly, and still to this day, I can shoot him a text and he will answer my question. I can assure you there are very few people like this man. They don't make them like him anymore. And I'm just forever grateful. My husband and I prayed for a long time to be guided in this journey. And I feel like after my original surgeon had said no to doing my surgery, I felt like I was at a crossroads, and I found him. And thanks to my husband for continuing to do some research behind my back. Thanks to my brother-in-law for having a connection to NYU and recommending this guy. I couldn't be happier. I couldn't be prouder to share this episode, because I think if you are somebody who is looking to go through surgery, or you've had a surgical experience, this man is truly in a league of his own. And I encourage anybody who's going through this to absolutely do your interviews, talk to these surgeons, make sure that they are championing for you like this man did. I feel like I owe him so much. And all he wants in return is to see my smiling face living life on the other side of this. I know you're going to enjoy this episode. I hope you get some laughs out of it. You can see I was grinning ear to ear half the time talking to him. He's brilliant. He does share some details about my surgery, which honestly still blow my mind when I think about it. And I hope you learn something from this. Dr. Cerfolio, if you are watching this playback, I love you. I adore you. I think the world of you. I'm so eternally grateful for you and for your time to sit with me and have a fun chat and record this episode. So please enjoy and welcome to the Forward Think Tank, Dr. Robert Cerfolio. Hello, everybody, and welcome back to the Forward Think Tank. It is my honor. I am so excited for this interview today. It gives me such joy to be here, sitting on the other side of the screen from my doctor, the Chief of Clinical Thoracic Surgery at NYU, Dr. Robert J. Cerfolio. Thank you so much for joining me today.
Thank you.
Truly feel like it's a miracle that I'm even here on the other side of, the camera, talking to you, feeling great, healing well. And
And
I
look
just
great, I might add. You look fantastic.
thank you. Thank you. I know you're a busy guy. I just want to thank you for your time. I started this podcast back in September as a way of sharing my healing journey and also connecting with people who have other health diagnoses. And I've had the honor of talking to a lot of different doctors on this platform and just knowing how successful the surgery was, but even getting to know you as a person and really feeling like you have such a great vibe and energy about you. I just couldn't wait to have you on here. And Nick said it actually when we first met you. He's like, you got to bring him on. I was like, relax. We need to make sure surgery goes well first.
Yes.
So thank you so much.
Well, as I said to you earlier, really all this credit goes to you, your faith, your incredible family. What a beautiful, loving family. And I've been doing it a long time, as you mentioned, 19,280 some odd operations. And
Wow.
we see people who we think get really good operations in the operating room and then don't do as well as we had hoped or prayed or envisioned when the operation went well. And so much of that is due to the love at home, the prayers at home, the support at home, the person's own psyche and how they see the glass half full, half empty. I mean, you were in a very difficult problem. You never lost your faith. You remained sanguine throughout. You never had any questions. You were resilient in that you were going to get a good outcome, and you shopped around to find a team, not a doctor, a team at NYU, and the NYU team that was able to, lucky enough, resect this tumor. And you get all that credit. We just did a little operation.
Just a little operation.
Well, I mean, how many years have your mom and dad and your husband been with you, and how much time was I with you? So 3 hours in the operating room.
It's true.
Of
Yeah.
love and support.
Yeah. I mean, I appreciate that. I think even you just saying that right there from the moment I met you, and I actually, I don't know if I told you this, but I resisted our initial appointment just because I was in such a weak place after having that myasthenia crisis. And so you were the third or fourth surgeon that we talked to. But at the end of the day, the guy who I thought was going to be my guy, who was actually very scary, not friendly, didn't have the best bedside manner, but he was, skilled, scared me and wasn't on board to do this surgery. So when I found you and then met you in person, and you had this bright blue suit on and you were very endearing and friendly and conversational. Like I felt like you answered my questions. You heard me. You gave me a hug. Like all of these things that I'm sure are just part of who you are as a person meant so much to me. So have you always been that way? Is that something that was learned? Is that just, your personality?
As a physician, you have to be authentic to who you are. And I do have verve and I am bubbly and maybe too bubbly, and that turns people off, right? And I get
love
that.
it.
Well, and I appreciate that it resonated with you, but it doesn't resonate with other patients. And I am different with different patients. Some patients are all purely data driven, unequivocally don't want to hug. I hug very few people afterwards, but I could feel that you wanted that and needed that, and we established that. Some are just very data driven and just want to hear the data, and they come to us because we've done the most and have the best results or are ranked this or that. We're ranked #1 in U.S. News and World Report, and they're chasing that. I always tell the doctors that the reality is being great in the operating room when the patient's asleep and no one can see you doesn't make them have a good experience. The patient experience is one of the single most important things we deliver, and as surgeons, it's one of the worst things we deliver. We do a very poor job post-op managing pain and anxiety and patients' concerns. And I spent a lifetime trying to do that, giving every patient my cell phone for 20 years. We do a poor job preoperatively of making people feel loved and valued and safe. And part of it is the system. We're seeing 20, 30, 40 people in our clinic day. Part of it is the business of medicine. And, I was COO of the healthcare system for a while and have an MBA, and I understand all that, no money, no mission. But the reason I like medicine better and caring for patients than the business part is because this is what makes it all worth it. When you have a patient that you and your team are lucky enough to be able to deliver the outcome that they deserve. And if I ever met a patient who didn't deserve a great outcome more than you, I can't remember one. So, such a loving, beautiful family, and your spirit just soars out of you and just flows out of your pores. It was my honor to meet you, and what a great honor and privilege to operate on you and serve you.
Thank you. I mean, if you're listening to this and you've ever had a conversation with a surgeon who talks like this, like you are just, it means so much to me, because when I say that my whole family knew that surgery was likely inevitable because of the size of the tumor,
Right.
they saw me kind of like a shell of myself the entire year talking to the couple surgeons that we spoke to. And then I met you in December. So really our relationship has not been a very long one.
True.
But as soon as I had that conversation with you and I looked you square in the eye and I said, I need to know that you and your team are the right people to do this job.
Right.
Because I've never been cut open before. It's a very vulnerable thing. And so the fact that you looked at me with confidence and certainty and you said, yes. And I know you trust your team, and clearly you've been doing this for a long time. So I'd love to hear, what actually inspired you to get into thoracic surgery specifically, but it took such a weight of relief off my shoulders. I was like, okay, you met my husband. Obviously Nick says hello. He's not here right now.
He's the
But
best. Please give him my
he is the best. I'm like, the two of you, I feel like just have like a similar,
Yeah,
maybe it's because you're both from New Jersey. You're both just like, Italian guys. You're both full of faith, and his faith certainly has kept me afloat this year. But
yes.
when I tell you, we prayed on this and then it connected us to you and we left that conversation and I was like, this is my guy.
Yeah, but his love for you and your love for him was what shined the brightest when we met, and I could feel that. And I'm like, she's so lucky to have this guy. He's such a total winner and everything, you can tell.
He
But
is.
he just loved and adored you, and his whole world are you, and vice versa. That resonated with me because I lost my wife to cancer. So I've been on that other seat with my wife, who had a horrible problem that unfortunately they weren't lucky enough to be able to get her the outcome that you have right now.
Yeah.
It reminded me of that, of course, and I don't want him or anyone to go through what I went through. So again, it was my honor and privilege to meet you. And finally, you mentioned the team and your operation. As you know, I only have other surgeons in my operating room probably in less than 1% of my operations. It's pretty rare. If we do 300 operations a year, there's maybe 2 or 3 times we have multiple other surgeons in. But in your case, we planned that right up front. We knew we might be replacing some of the cava of the vessels, so we wanted a vascular surgeon. We knew we might be replacing some of the cava and atrium of the heart, so we had a world-class congenital heart surgeon, TK Shashil Sharma. I love Shashil.
He's so great.
We had Dr. Michael Zervos, one of the best surgeons in the world, in my opinion, if not the best. He was there because of his great experience. He's a thoracic surgeon like me. He has a series of doing this with Shashil, where he placed cavas for people with thymomas that are large, 10, 15, 20 centimeters tumor, bulky, involving these parts of the anatomy. I don't want to get too technical, but it's the team. It's Dr. Zervos and Dr. Sharma and that entire team, and the anesthesiologist, where we had both congenital anesthesiologists and adult cardiac and thoracic, and the nurses and the circulators. All that is a critical part of it. I'm a part of it, but I'm a small part of it. And so you benefited not from me, but from NYU Langone's experience and commitment to excellence and exceptionalism.
Yeah. And I have to say, I respect you for saying that, because as somebody who's been doing this for a long time and you have tens of thousands of surgeries under your belt, you could very well take credit for that, but you don't. You definitely credit the team. And I'm very much an energy person. So I left our initial conversation. I was talking to my therapist, who's been amazing, and we talk about a lot of things. She's almost like a coach to me. And I said,
Yes.
I feel like this man, you hear stories, or at least I've heard stories, having never undergone surgery, about the energy in the room when you're under anesthesia and what's happening and how well people are communicating and the tension, all that. I said, regardless of what actually happens, I'm going to be out of it. But I feel like the conversation that I just had with this guy and the way he spoke about his team and the confidence in his team, and then seeing, after we left, that you've written books about coaching a surgical team and the importance of that. I feel like that energy in the room alone is going to help further along the healing journey.
I agree with you. I played a lot of sports. My kids all played a lot of sports. And so the energy on game day is critical. But my point is that energy is predetermined by your hard work and preparation months before. You can't go in confident to something that you have not prepared for, don't have the technical ability to achieve. That's false confidence, and there's nothing worse. That's hubris. You go in with great humility, but only humility that's based on all kinds of preparation. And if it's a game, it's reviewing the films. And if you're a surgeon, it's reviewing the films of your anatomy and the CT scanning, going over it again and again, and asking the surgeons who I asked to come to the OR to cancel other things in their day, which is a conversation I had with one of the surgeons a week before because we didn't know the exact extent. And those are tough conversations because all of us have multiple operations each day. But we were committed to making sure that we were all going to be there the whole day, blocked off. Normally we do 3 or 4 operations a day. Mike's in one room doing 3 or 4, on another room doing 2 or 3 on the robot. Shield is off doing 1 day 2-year-old babies. He's got emergencies and kids who were born. But we blocked that day off because of you, not just because we do it for patients that aren't like you. We do it for everybody. We unconditionally love the patients coming in. But for you, my goodness, it was so easy with you and your husband. It was so easy to be in 100% service mode for people like you. The honor is mine to have met you and to have served part of your care. Honestly, it's just incredible. And then you have this show, which again speaks to how you want to give back and help. It's beautiful.
Thank you. Yeah, I mean, I think it's important. I work with a naturopathic oncologist, not to derail the conversation, but I meet with her in a group setting on Zoom every week with a group of people that she's consulting with all different types of diagnoses. But there was a point in time, this was maybe right after we had met, and a couple people were voicing their concern about meeting a surgeon and finding the right surgeon. It can be very daunting. And so I encouraged them. I said, obviously I prayed about this. Not everyone has that mindset, but I said, I feel like I was led to him. And then you talk about somebody that matches your energy. I was like, I don't know. He told me he wears his lucky socks to surgery. He had this like awesome, brightly colored suit on. He just had like the spunk. And that is what I feel like had been missing for me a lot of this year. One, because I had a surgeon telling me, don't lift more than 10 pounds. And then I ask you how you felt about that. You're like, that's a gallon of milk. That's silly. Like, I need you to be strong. So I encouraged those people who were asking questions. I said, talk to these surgeons like you told me, I guess, when I first met you, you said, I'm not the boss. You're the boss. I work for you.
Yeah, well, that's 100% true. You are the boss. I mean, the hospital charges you money and you're paying us. So we work for you. You're the boss, and it's about delivering the product you deserve. Going back to lifting the 10 pounds, that was pre-op. So when I first met you, you were so weak and were just sitting and not exercising. I'm like, how are we going to get you through a median sternotomy, maybe go on bypass, which we didn't have to do, fortunately, but maybe.
Thank God.
Gigantic, 14 centimeter tumor with into the lung, into the right phrenic nerve, made invasion to the left phrenic nerve. The entire cava and innominate vein were all destroyed with tumor. How are we going to do that unless you're in good shape? So I think this is where surgeons don't do a great job in general, and they want to farm it out, and I get it, but it is nutrition and physical therapy and mental and emotional. Everyone talks about wellness and health. 90% of it is your mindset and how well you sleep. And I coach a lot of surgeons. They want to have a couple of glasses of alcohol a week. That's just poison, man. Doesn't make sense. They want to sleep late on Saturdays, Sundays. That doesn't make sense because the best way to sleep is to go to bed the same time and wake up the same time. You got to have a complete commitment. If you want to be the best anything, the best baseball player when I was in college or the best surgeon, it's a complete commitment in your life to excellence and health. And that is doing those things, not drinking. not smoking, not taking drugs. I love Ayurvedic medicine and herbs. I've got herbs up here that I use as well. So I'm not just a traditional Western surgeon that only looks at p-values and data. There's a huge other part of this that I believe in, but I'm still essentially data-driven and metricized about what I'm going to do. But I'm all for alternative medicine because some of those are clearly better and have less risk than the chemotherapies we give or some of the operations we do.
Yep, absolutely. I couldn't agree more with everything you just said.
Yep.
And I appreciate that insight too, because I think we did a pulmonary function test. We did a stress test after I first met you. And when I tell you, I hadn't gotten my heart rate up that high like all year. So I was nervous, but somebody who I grew up a dancer my entire life. So in my own way, I was an athlete. I had always been physically fit. I taught fitness all throughout Manhattan for a decade. I just was so scared. And so to hear you say, no, I need you to be strong. No, I need you to like be able to recover from your surgery. You're okay. And then we did the stress test and I was like, oh my God, I'm okay. It's like, I don't have to treat myself like this delicate little butterfly. It changed my mentality for sure.
And you're an ex-Buffalo Bill cheerleader. So you're great. So let's not forget that. But all those things that you did were the dividends, because we see a lot of patients who are, morbidly obese, they smoke, they drink, they don't work out, and they come and we're not going to get them in a month ready for surgery. In your case, within 4 to 6 weeks, now you had a myasthenia gravis crisis going on that we needed to get you over. We did plasmapheresis and IVIG. We did some real database things to get you in shape. But the most important thing is when I met you was to give you hope, one. Two, to let you know that your nutrition, your physical therapy are going to be critical because you could get stuck on a ventilator. And I have not had a patient get stuck on a ventilator in 12 years. And we do a lot of myasthenia gravis. Well, again, that's a credit to the preoperative team. When I first met you, I'm like, this could be just not a little robotic operation because we do 99% robotically. This is going to be a median sternotomy and replacement of the cave and an ominous vein. It's going to be a 3-4 hour operation. And if she doesn't come in great shape, she's going to be on the ventilator, and that is a loss. We don't want anyone leaving the operating room on a ventilator or even a chest tube. So for the people listening, we do lung surgery, and we consider it a loss if you leave the operating room with a chest tube, which probably no other surgeon in the world sees it that way, but that's how I see it. So we're fast tracking everything because we know patients do better with less. Less is better in surgery and medicine. Less medicines, less time in the hospital, less pain medicines, less surgical time, less everything. Less is better.
Yep. And when I say I feel like I met my match in the way that you see all of that, it was such a relief because in contrast, the other surgeon was saying, oh yeah, granted, he had a totally different strategy. And I know we talked about that, but he was planning for me to be in the hospital for 2 weeks. And with you were like, I want you no more than 1 to 2 days, which it's startling to hear such a contrast. So I was like, oh God, okay.
Well, and I get that a lot. I have a lot of international patients who come to us because we do mostly robotic lung cancer surgery or thymectomies and stuff or esophagectomies. And our lung cancer patients have the tube out in the OR and they can go home that day and everyone goes home the next morning. Everyone, 99.8%. Which is not everyone, but almost everyone. And people are like, well, I just saw the world famous surgeon in France or the world surgeon in Japan. I'm like, listen, bro, I get it. We do a similar operation. We do it a little bit faster. We take a little more lymph nodes. We maybe lose a little less blood. But the operative technique is not that much different. And I don't want to overplay our skill set. I mean, we've done the most robotic operations, but are we that much better in the operating room? I think we do things better, and they probably do things better than us. But our mindset is to get everything out quickly. It's a conversation I had with a young resident about a chest tube today. Still having the same conversations. I'll take them to my grave. Doctors are resistant. They think it's better to leave tubes in. And they got that wrong. That I know. Less is better.
Yeah. I mean, I was shocked, I guess, even though I knew that was your mindset, being able to go home the next day. I mean, my parents were here. They'd driven up from Rochester. They were not expecting me.
I know.
It was a great feeling. Also for me, as soon as I I was in a wheelchair at that point. I also was like feeling a little faint because I know we avoided the transfusion and all the things that I was like, hell yeah, like less is more for me. So when you were like, I want you to go home. That's where you heal. I just appreciated that so much. I just felt the cobwebs coming off my brain as like I got wheeled out of that floor
Correct.
into the elevator, then outside into the car. I was just like, huh.
And for the audience listening, I hope you have a huge audience. I'm sure you do. But
Working on it.
there's a disconnect that they quote, oh, the doctor threw me out of the hospital. The doctor's pushing me out of the hospital. My own father and mother went home post-operative day 1 and 2 after open heart surgery, which back then was a week in the hospital. Why? Why do I send all my patients home on post-operative day 1? Because it's better for the hospital? No, it's better for the patient. And I'll give you 100 examples.
If you are listening to this episode and thinking, I have a serious healthcare diagnosis, I've been dealt the cancer card, I want to have support around ways I can heal myself using naturopathic healing, and I need somebody who gets it, please take advantage of this opportunity to work with my naturopath, Dr. Lori Bouchard. Dr. Lori was nice enough to offer a free 30-minute strategy call to dive deep into your personal needs, understand more about your unique diagnosis, and see how she could help. So if you have been listening to my episodes, maybe you listened to my interview with Dr. Lori recently, we talk about cancer as a metabolic disease. And when you look at it from that lens, you need to work on your metabolic health, whether that is focusing on your nutrition, focusing on certain things in fitness, maybe fine-tuning your supplements, working on the mental health healing process. This is all encompassing and something you'll learn in the Metabolic Cancer Reset program. This program is designed by Dr. Lori. It is an incredible program where not only do you get one-on-one time with her, you dive deep into your lab work that you look at in a very specific naturopathic lens on a monthly basis. You also get access to her weekly group calls. So it is a great way to have resources, connect with other people who are going through something similar and who can understand what you're going through. You also get a program with Dr. Lori. So in her Metabolic Cancer Reset program, she provides multiple videos talking about getting into ketosis, about nutrition, about fasting, different ways to even work with the conventional side of treatment. If this is something you're interested in, or maybe you're thinking, I really want to send this information to a friend, to a coworker, a family member, a significant other, somebody else who may be dealing with a significant healthcare diagnosis of their own and they're looking to get support on their healing journey, Dr. Lori is providing a free 30-minute strategy call. Take a look at the description of this episode. I will link it below. I promise it will change the game in terms of your healing process. So I hope you enjoy, and thank you, Dr. Lori, for that gracious offer.
One, in the hospital, you can't walk because every time you go to walk, they say you need a nurse, you need a physical therapist. We don't have enough of them. Or they say you're too tachycardic. It's a good reason to walk. 2, you get infections in the hospital, C. diff, COVID, HIV, who knows what you can get. 3, you can get the wrong medicines. 4, people have pain, and the nurse would say, well, I know you have pain, but we gave you that medicine 3 hours and 58 minutes ago. You can only get it every 4 hours, so you're going to have to wait. Do you think that happens at home? No. It's ludicrous. Your own bed, your own food. Now, people who go home and don't have what you have, it's a little different. But even for them, we take 2 or 3 weeks pre-op and either get a physical therapy set up or a rehab center. So they go home if they live alone and they're elderly or their spouse is elderly and sicker than them to a rehab center, which is not ideal. It's better if they go home. We have an uncle or aunt usually fly in, which is what I did yesterday with a 91-year-old physician we operated on who lives alone. I had his son come, who's a doctor, didn't want to come. I begged him. So he came for 2 days. But I mean, this is part of it. It is better for you to go home sooner. You do better. You won't get confused. You don't get iatrogenic mistakes. You don't get iatrogenic infections or nosocomial infections. And the list goes on and on and on. And is it better for the hospital? Yes. The bed's open and another patient who has cancer can come use it instead of someone there eating bacon and eggs that doesn't need to be there. And every day I rounded a COO, I saw it. Drove me crazy, and I'm glad I'm out of the job because doctors don't change. They won't listen.
Yeah. Yeah. Well, yes, I agree. It's the last place I want to be to sleep as well. You don't get good sleep there. The monitors are buzzing. People are poking and prodding you. Like,
we have to
no
have
way.
you by law. We have to have EKG leads on you. Who wants to sleep all tied up and wired up? And the pillow's not the right one. The mattress isn't. You sleep better at home.
Yeah.
And there's less noise.
For sure. For sure. I feel like without even looking at my questions, we have covered so much.
Yes.
I would love to hear from you before I dive into the rest of the questions. I would love to hear the role that faith plays in your life and faith plays in your career. And I want to, kind of back that up with this pre-story, which I know I told you right before we started to record that I wanted to talk about because I was so amazed at how much my faith has been strengthened this year. So when people asked, what can I pray for you? I said, and I visualize this every single day. I said, I visualize that thing, shrinking or disappearing so that when you went in there, you're like, oh, we don't have anything. But, that can always happen. So I said, please pray that this backs away from the diaphragm, which I know was a concern because it was so close to the two phrenic nerves. And like, how do you breathe without a diaphragm? And backs away from the internal organs, which obviously what was done and we were able to get it all out and it was a miracle. But when you told me the story of what happened in the operating room and what happened with the phrenic nerves and like your decision making to do what you did, I was a puddle on the floor for like the next week. Everyone's like, are you okay? I'm like, yeah, I'm just thinking about what the surgeon said and it's a miracle. So if you don't mind sharing a bit about those details, I'm obviously okay with it because I think it just is a test to having a strong belief and knowing things are going to work out.
So the first, you asked two questions. The first is about my, so, that's a very individual and a very private thing. I'm happy to share. But most doctors, so remember, I practiced in Birmingham, Alabama for 20 years, where that was the first question every patient had. And it was easy to share my faith with them and we were aligned. But not in New York City. New York City, they come because I've done the most in the world. I've done the most robotic lobes or segments, or I've done 19,200 cases. Great. And sometimes the faith doesn't come up, but it doesn't need to. My wife had the most amazing faith of any person I ever met. And what happened? She died young from a cancer that was caused by chemo that she got for breast cancer that she probably didn't need. She got acute myelogenous leukemia induced from adriamycin chemo from an early breast cancer she had with one positive note. So my children see this, and of course it shook their faith. It strengthened mine because I saw my wife's unending resistance, my unending love and faith, and she never lost it, even though we got bad news week after week after week. So I have a faith, and it's actually, I think, the reason I beat people in close matches in pickleball or golf, when I'm close to arteries and nerves, I don't put holes in them, is because of that faith. Now, the scientists would say, no, it's because of process. It's a combination. The athlete or the surgeon or the doer at the time needs to have confidence. And that confidence is as much emotional as it is experiential, as it is mindset. And faith plays a big part in that. You can slow, deep breathe, and I teach a lot of people how to do this. But if they have a confidence and a love and a higher power and humility, and faith gives you some humility, it is great. So I think hubris is the biggest problem with surgeons, and humility always checks us down. I think that might our faith better. So that's answer one. The second answer to your question really is more of an algorithm that is very carefully thought of beforehand, and what I call the conduct of the game. And so I call it the game because I coach a lot of people that do sports. So in a baseball or a football or a hockey game, there are specific moments where you're going to do something differently because of the score or because of the circumstances. In the operating room, there's a very distinct conduct of surgery that I find many famous centers not following, which drives me crazy. So in your case, you had, and we're talking freely about your own health, so you've signed the HIPAA, so I appreciate that. But you had multiple nodules in the right chest, on the right lung, and those nodules can come back. We know that, but we took all these out, all that we could see, they're out. Then we saw you had direct invasion into the phrenic nerve and the lung on the right side. We knew going in, your right phrenic nerve was going to need to be resected. The left phrenic nerve is what everyone thought was involved. And we first did the sternotomy. I did too. So, some of my partners wanted to go on the left side. I'm like, listen, guys, no, we're not going on the left side. Doesn't look good. Let's see what we can do on the right. Because if we can't resect all the disease on the right, it doesn't make any sense to try to resect disease on the left and hurt the phrenic nerve if we're going to have a residual, what's called an R0 resection, means all the tumors removed. There's an R1, there's microscopic. R2, you leave gross disease. Everyone thought we were going to do an R2 resection. Well, after about 2 hours in, we had cleared the entire right chest. Now, yes, there's multiple nodules in the pleura, but they were all gone. And we did a pleurectomy. And then we got all the disease out from behind the heart, which was incredibly dangerous and difficult. I think I told you I've never lifted up on someone's your right inferior pulmonary vein. We were behind it. There was just too many. We got that all off, and we didn't have to take out the right inferior pulmonary vein, which we thought we might need replaced. We knew we had to replace the cava and the innominate vein for the surgeons. Listen. So now I got an R0 resection. So now I become much more aggressive because the conduct of the game says you got a chance, whatever it is, you're down 30 points, you got to throw the ball more than run the ball or whatever. So now we started getting very aggressive on the left side. And it's really interesting here. I actually even talked with one of the other surgeons. Now I start looking at the left side. I'm like, it doesn't look that bad. It looked really bad a few hours. Even my mindset is like, we're going to go get this. So we dug the left phrenic nerve out and put a little loop on it and lifted it up. And then we just got the entire tumor all off the left phrenic nerve. I feel confident that there won't be recurrences in that area. Even though we just bluntly, microscopically dissected it off, the whole thing looked like it completely came out. And there weren't multiple nodules. It was one rock. So if you get that out, the chance of recurrence is much less than multiple nodules. So now we know we saved the left phrenic nerve and we took out the whole left side. Then the only question was the innominate. We're like, well, listen, she's going to get an R0 resection. There's disease on this innominate vein. Let's replace that and finish the job. And so that's why we replaced the innominate and the superior vena cava as well, giving you an R0 resection. So you didn't have to get radiation or proton therapy, which is a gift that we don't want to give you. So
yes,
again, but I think this is what all surgeons do. They all talk about the conduct of the operation. I think you need to be thoughtful about it, getting lymph nodes first, looking for metastatic disease first. Every time we put a camera in the chest, we look for this. And I won't bore your audience with that, but I think it's something to think about and talk. We talk a lot about it. It's in my book, and I recently was a visiting professor at a famous place, and I'm like, aren't we going to look for metastatic disease first? Oh, yeah. I'm like, we're forgetting? I mean, so I see surgeons aren't doing this routinely, and of course we should.
Mm-hmm.
Yeah.
It is just amazing. And I think that I remember asking you, I don't know if you remember every single conversation, but I remember being like, are you good with your gut instinct? And you're like, I played sports, of course. I was like, okay, like you got to, obviously, I would assume being a surgeon, you have to be good on your feet. You have to be a critical thinker. Of course, you have to be like quick to pivot. But, with everything that you just shared and, what we spoke about after my surgery, I mean, again, everyone who's listening who may be looking for a surgeon, I feel like I made the joke this whole year, especially with my naturopath and like the group of people that I spoke to every week. It's like, I'm this unicorn because thymomas are rare.
Yes.
The myasthenia is rare. The fact that I don't feel anything despite the size is rare. And then I feel like you are the the unicorn surgeon because of just how you are. And I remember I have so many nurse friends. They're like, Jamie, most surgeons are scary. Most surgeons are antisocial. Most surgeons are just black and white.
Yep.
And so I'm like, well, I really like this guy and he's got a great personality. Does that mean there's something wrong and he's not going to have a successful surgery? You can't have both.
Yeah, I got that one too. But I would go back to what you talk about gut instinct. I would say also, because I am data driven, that is pattern recognition. And pattern recognition improves with experience. And what we're trying to do now is use AI and videos and other things to improve young surgeons' experience, like I did with my children who all played football, basketball, baseball, hockey. We watch videos and I say, stop. What's going to happen now? Like in a basketball game, where's he going to go? Let's recognize this pattern. You can anticipate this pass, tip it off. You got a free breakaway and layup. My kids had lots of steals because of pattern recognition. And I mean, I'm talking about when they're 6 and 7 and 8 years old in AAU basketball. And so surgery is pattern recognition. It is, as is radiology, as is pathology. So I think it's a little bit of gut instinct, but it's having been there before. And if you're 30, which is very young for a surgeon, you're going to say, I don't have experience. Yeah, you do. I've got, 120 videos online that go through the anatomy and say, here's a pattern where you want to take this A1 artery or A2 before you do it from the front or the back or whatever. It is pattern recognition. There's some gut instinct, but much of it is pattern.
Hmm. Makes sense.
Yep.
Definitely makes sense. I know I put this in my questions, but do you know what off the top of your head, what number surgery I was in your
I,
career?
I didn't look that up, but I can tell you I did 19,278 yesterday. So you probably around 19,200 would be my guess, total operation.
Wow. What a milestone. I mean, that it's just incredible.
Well, it's an honor to serve that number of people. And we're coming up on, we're doing, I think, 2,980 robots are coming on our 3,000 robotic thoracic operation.
Wow.
And you
Wow.
asked how I got into thoracic surgery. I didn't start off in it. My dad's a urologist, and my dad is the greatest man I ever met by far. And I wanted to be like him, so I started off in urology, and then fell in love with cardiothoracic during general surgical residency, and
Mm.
switched. And never thought I'd be doing robotics. I was laughed at when I started doing robotics, but
Yeah. Tell me how you
yeah,
got into that because it seemed like, from what I read, anyways, you pioneered that effort.
yeah,
Um,
that is 100% inaccurate. I was no pioneer. Franca Melfi, a woman in Italy,
mm,
Dr. Franca Melfi, remember her name? She
hmm
gets that credit. She was the pioneer. And because she's a woman and in Italy, she hasn't gotten the credit. So everywhere I
mm,
go, I put a picture up of her first when they introduce me as, the world's most experienced and best and pioneer. Hang on, not right. Here's the pioneer, done more, than us and who's better than us. So she's the pioneer. Now, she didn't mainstream it. I have more of a national, international visibility at the time. I was writing more papers and lecturing, and I have a more challenging personality. She's very nice. I'm not so nice. And so when people told me this was crazy, and I'm like, okay, great, show me the data. Tell me why. Here's what we're doing. Come watch. And then one by one, surgeons started to come watch. Some tried
mm,
to take it home, and patients didn't do well. A lot of intraoperative deaths, set the robot back. But they blamed the robot, but it was the surgeon. And
yeah,
then now it's done more than video assisted thoracoscopy. So now it's mainstream for what we do.
mm,
That's a credit to the company, the Da Vinci Intuitive Company. It's a credit to the training processes we developed. It's a credit really to the fact that surgeons want to get better. And I
yeah.
think every morning I wake up, I want to get better. That's what it's all about. How are we going to get better today?
It's a great mindset, especially after having had such a long career in doing this. The fact that you're always wanting to improve, I think, speaks
We
volumes about
did a
your
new workout
character.
gym today because I got to get a little bit stronger. I got to get off the tee box a little better with my driver. I'm playing against guys who are 30 hitting the 310, and my drives don't cut it. And I got to get better in the operating. That's why we're taking tubes out before people wake up, and we're teaching better, and we're using AI and leveraging all the technology to try to get better in every role we have. And those roles include being a wife, being a daughter, being a mom or a dad or a sister and a brother. You got to get better in all those roles too, not just
Yeah,
our professional roles.
absolutely.
Yeah.
So I know I had asked you if there was anything you wanted to touch on, and I want to make sure we don't miss it. You had mentioned, when you search and chat currently, like who is the best living robotic thoracic surgeon, your name comes up, which is amazing. But you had
Yep.
some thoughts on that. And I know you wanted to also speak to the importance of your team, which I know you did a little bit. Whatever you would like to
Yeah.
share about that, please
Because
make
it's a
sure we
big
do it
part.
justice.
I'm doing an interview a little bit later because of that. And the person who's
Ah,
interviewing met me, and they want to talk to the world's best living robotic thoracic surgeon. First of all, it's not even measurable. So we're honored at NYU Langone that we have two or three of the best robotic thoracic surgeons, and Michael Zervos and others clearly are them. And we're proud of us and our team and what we've accomplished. And we're proud to be ranked number one in lung surgery in the United States or North America and U.S. News and World Report. But even that, the surgeons who are listening, who are like, this guy's full of baloney, better than him, there are surgeons out there that could be absolutely better. And the metrics that get there are protean and vague and not so clear. So some of this is marketing. Some of this is my volume. Some of this is because I write. Some of this because of newspaper articles and how NYU links, or how when you take an ad out on the internet, you can find a way to be higher ranked. All of this, some of that
yeah,
is. So I'm the first to say that it is not measurable to say he or she is the best surgeon in anything. I just don't think it's measurable. I think you can look at operative times and blood loss and lymph nodes and length of stay and chest tube duration and 30 and 90-day mortality. And we're great at all those. So, but does that define it? To me, it's patient experience. Does the patient love you and trust you? Did you take care of them post-op, which we don't measure? Did you get back to them right away? If they called your office, if a new office calls, we get back in 6 hours. I give everyone my cell phone, my email. That I think we do much better than other surgeons.
Absolutely.
But we're not perfect there either. So we're glad to have the title, but the title goes to a team, because what can I do on my own in my living room? Can't do jack, can't do anything. What could you do if you picked me up and brought me to a hospital, didn't have a good anesthesiologist or the wrong nurses post-op? All of a sudden, I'm average or below average. So it really, honestly, and this is not humility or blowing smoke, this is the reality. It is an incredible team approach, because your operative times are going to be long if you don't have a good nurse that helps you turn the patient and prep and drape them, or an anesthesiologist to put the double lumen tube in, et cetera. So we love the title, but we want to know, we don't really feel like we deserve it. It's not measurable. It's not warranted. It's not an objective title. And I'm sure it'll be somebody else tomorrow. But
Yeah.
we've had it for a few months. So that's what these interviews I'm doing a lot about are lately.
Yeah. I mean, it's fair to say, but I think you also brought up some really good points. I mean, one, just about the way chat works and the search and all of that. But I
Right.
do think that from a patient experience, and I actually had told multiple people this when I was in the hospital, you were my first connection into the NYU system. And then I found it extremely rare, but also extremely wonderful for me. Somebody who has a lot of questions,
Yeah.
who wants to get them answered, that you were giving me your phone number, that you were giving me your email, that you were allowing me to email my questions to the other surgeons. And then
Yes.
not only that, but like, then we got to the hospital. The nurse was great. Dr. Jan, incredibly conversational, found out he lives in the same, not neighborhood, but also lives in Jersey City. And anyways, every nurse that I had, like, I felt like there is some sort of elite level of training or hiring that goes above and beyond the skill set and really brings a culture to NYU that makes it personal and comforting and made me feel like I was so taken care of. And that, to me, like, bedside manner goes such a long way. So
Yes.
my patient experience was great. You know, when I had my 2-week follow-up with you and you're like, you look good, you're done with me, I was like, no.
Well, I was trying to give you a present because you don't want to look at this often. I get it. But
No, you've been really great. And my whole family is like, what do we do for him? We want
no,
to invite him to Christmas.
no, nothing. And that's the other thing. When we get gifts, we feel very uncomfortable. So don't send it. We don't need anything. We have this incredible gift we get, and is that smile. It is you doing well. It's you getting a CAT scan in 3 months, in 6 months, in 1 year, and it's negative. That's the gift. And honestly, that is really, really true. To quote my son, no one is worse at receiving gifts than me. I am exceedingly uncomfortable with it. So it's just the way we're trained as physicians. You stand up and you take this oath, and it is so powerful. That oath, it's like getting married. It's like promising your wife on an altar in front of her family. You're going to be true to her and honor her, and you're going to be with her through sickness and death. And I always thought I would die before. But it's like that oath. It is an incredible commitment. And we do it because we love it. And I'm so lucky to wake up in the morning and I'm going to get to operate. You know, I operate every Monday and Wednesday and sometimes other days, and I get to do it. And that means people are allowing us who just met us to bring us in an operating room, paralyze them. They're naked and paralyzed, and operate in one of their organ systems, or in a cavity in the chest, the brain, the abdomen. I mean, what an honor. And that's the gift. That's the only gift we need, is for you to do well and be happy with the care. That's the gift.
Yeah. I mean, not only were you doing that, though, but you also came to visit me post-op, and I have to laugh. Like, my husband and I were both laughing because this is just goes to show you, like, how a surgeon thinks, like, perfectionist mindset. You were like, you got a little sticky here. Somebody give me like an alcohol swab. Like, what's happening? Like, you just,
the EKG, that drives me.
yeah.
So,
I'm laughing because it was the last thing I would expect you to be doing as my surgeon, but
well,
it just
about washing all the soap off and
Yeah,
they put initials on you and then we wash them off. That little thing. Yeah, we want, the skin gets abused in the hospital. This is another
for
lecture.
sure.
But people abuse patients' skin with tape and taper. That's why your incisions had really no tape. Although for sternotomy, we do a little bit differently. For my little incisions on the side, no tape. But the skin gets abused with the EKG leads, and it leads to burns and pain, and that does matter to me. We want to
Yeah.
return you the way the good Lord gave us to you.
Yeah. Yeah. I mean, so far, like I said, I'm feeling good and I feel like there's just been a huge weight lifted off my shoulder, also out of my chest. That thing must
Yeah,
have been like
yeah. Well,
5 pounds.
that was a heavy tumor. You definitely lost some weight.
Yeah, it's insane.
Yeah,
But, I feel a little bit more like myself each day. And I'm really very grateful to you and your team and to God and to all the angels that watched over that whole surgery. It's just
they were there.
a wonderful thing.
They were there because of your family and your love and your faith. So, again, so much of this credit goes to the wonderful people I met, your husband and others who have just, supported you with just love, incredible amounts of love and prayers from the beginning. And that's a huge part of it.
For sure.
Yep.
I'll have to, because I have your number,
Yes.
I'll have to send you a video. This is what I did. This is who I am. Maybe we'll make it a little bit more memorable because I was a dancer, but I had an idea before surgery. I choreographed this whole dance, and it was a song that was like encouraging, and it was like a remix of Celine Dion's song "I'm Alive" from like the 90s.
Great
And
song.
I said, I need this because I know I'm not going to be dancing necessarily. I mean, I was dancing a little bit, like maybe a few days after, but like not in the way that I normally would.
Yes.
So I put it out there on social media. I said, hey, whoever wants to learn this dance with me, it would mean so much to see you all dancing post-op. For me, it'll be entertaining. So I did it and people took a like to it. And,
Great.
I had like 20, 30 people do it and I put together a video and it just like, I would watch that every morning, make myself cry. And then I would think about our conversation about how well the surgery went and make myself cry, just like tears of joy.
That's
So
beautiful. That's living life to the fullest, right? That's
yeah,
all the gamuts of emotion that we have. So
totally. So I know you always say to me, it is your honor to serve me. I appreciate that so much. It has been my honor to have you here,
thank you.
have this conversation.
Thank you.
My podcast is called The Forward Think Tank because my maiden name was Forward, but I'm a very forward thinker, forward person. And I want this to be a place of inspiration and education and conversations like this that can help make a difference in somebody's life who's going through something major. But I ask every guest that I have, just to kind of summarize and wind things down, what inspires you to move forward in your life?
People like you. I was just sitting here thinking that your maiden name is Forward, so I didn't know that. But I'm not a person that believes in destiny and things, but maybe your destiny was to give you this challenge, and now this platform to inspire others. Your maiden name is Forward. It's incredible. So it's the patients that we meet. What inspires me? I guess my dad gave me a work ethic, and now I have a job that I love. I get up and love what I do. Boy, what a blessing, because I have friends that don't love it. So, and I know I can get better. I know I'm only 62. I got a good 15 years left. And I'm much better now than I was a few years ago. And at some point, that won't be true. And that's the other thing surgeons need to know is when to check out. And now we have AI and metrics that can look at our hand motions and say, listen, you're losing it. Time to get out. So I'll be ready for that, because surgeons that stay around too long is a really bad look.
Yeah.
But I'm inspired to get better. But I'm more inspired also to spread the word of how to get better to people, not just in medicine. I've written a few books. I lecture a lot. I coach CEOs and COOs as well as surgeons. We got to get the word out there about how to grow teams and make teams better. And just in the lane of medicine, how we can care for patients better by giving them better patient experience. I want to challenge every doctor who's listening. I give every patient my cell phone. Been doing it for 15 years. It is the reason why we get better results. It's an early warning signal. When they're home and they're not doing well, and they text you, a pulse ox and the saturation's low and the heart rate is low or high, I'm like, that's probably not good. And I call them in FaceTime. I say, come to the hospital. We've caught early pneumonias, early DVTs, early pulmonary emboli. And in the past, they just call it answering service, and the person I'll call and say, hey, you're okay. Here's to Tylenol, and then hang up. And it's that stuff that we have to do a better job managing people's pain, managing their anxiety before surgery, managing their questions post-op. And yeah, we can mercantilize it and make companies and make a lot of money, but it would just be nice if the doctors just started doing it on their own. We all get paid pretty well. We can do what we're already paid for. So that would be my ending remark, is to challenge your listeners to let's all get better together.
I love that. Yeah. Yeah. I mean, just one quick, not a joke, but it threw me and I laughed and I was like, you're right. Talking about managing anxiety. I remember when I had a list of questions for you and I wanted to talk about every possible complication and you got a little cheeky and you said, yeah, let's talk about the complications. You could fall in the bathtub the night before. You could get into a car accident on the way to surgery. And I'm like, what? He's not. Well, oh, I see what you're doing.
Yeah. By the way, it's more likely for you to get in a car accident on the way than die in the operating room, although you even know a big operation, or to get a stroke or an MI. And all the surgeons list all those things. I don't really list them. I say there's all these terrible things that can happen. Altogether, they're 0.5%. And when they challenge me, I'm like, the ceiling could hit you on the head, right? It could be a terrorist attack right during the time of the operation. Those are all. But because we're surgeons, we have to list these ridiculous things. So I'm going to the other ridiculous things that could happen to say, look, I've done 19,200 of these. These things have never happened to me. Why would it happen tomorrow? It's not going to. I'm going to go to bed early. I'm going to prepare. My team's going to be ready. I'm going to be there early. I'm going to walk you in the OR. We're going to love you. I'm there when you go to sleep. I make your incisions. I close your incisions. I'm not like the other professors. No one opens and closes. I do it. I'm there for all of it. And that matters. And so, you could get these horrible, unusual complications. Malignant hypothermia from the anesthesia. It's unlikely.
Yeah. I think what that did, though, is it encouraged me. And you said, I want you to keep your mind in a good place. It was like, I went from like, to like, oh, yeah, right. Okay. Just focus on the good, which I'd been trying to do all year. So I appreciated that.
And I had a patient email me today who says he saw another surgeon who listed all these complications with robotic surgery. Why didn't you? And my response was, there's a whole bunch more too, but I haven't had any of those. One of them was the robot breaking down in the middle of the operation. I mean, I did have that happen to me one time, and we rolled another one in and finished the operation. Yeah. So the questions, if we spend too much time talking about all the things that can go wrong, our energy is being focused on the wrong thing.
Absolutely.
I would focus our energy on the proper preparation beforehand to ensure that nothing goes wrong. And that is what we do at NYU Langone, or try to do.
I love it. Well, thank you again so much. I love you. My whole family loves you. You've got a big fan club over here.
Someone has to not hate. Thank you.
You're welcome. It's such an important conversation. So I look forward to releasing it next month. And just thank you for your time.
Thank you for your time. And you remain in my thoughts and prayers. And one day at a time, keep pushing yourself in the gym. You look fantastic.
Thank you.
Bye-bye. Thank you.
Did you enjoy this episode? If so, I would appreciate you taking a moment to please leave a 5-star review. Every review helps visibility with this episode to reach more people. And I am on a mission to help people learn alternate resources to support themselves in their healing journey on their road to health. So please take a moment to leave a review, leave a comment. I read every single one and I respond back. And of course, the most helpful thing you can do is to share this episode. If you found it helpful, if you found it entertaining, please share it on social media, send it to a friend, a loved one, someone you think could find this helpful. It means the absolute world to me. Thank you so much for being here. Thank you for listening, and I will see you soon.